Jayaji, very good morning and congratulations for the wonderful flag off that happened today to mark the marathon and the
Right.
race at Ahmedabad.
Yeah.
But one question I want to ask you is, ma'am, whenever somebody hears the word rare disease,
Right.
what should come in their mind as a compassion and an act of helping them?
Absolutely. So I think firstly thank you अहमदाबाद, आप लोग आए और हमारे साथ जुड़े. संख्या और बढ़नी चाहिए. I think we're looking at larger numbers in the coming years, but rightly pointed out by you, till the time people don't know what are these diseases, they will not feel anything for it. There will be no empathy, there will be no compassion. So I think let's get them connected to these rare diseases. So I'll give a few examples which I generally do to when I'm talking to and pitching to public and corporates. Pa talked about sorry, 1 second. Pa talked about which progeria. See, yeah. Okay, sorry. So Par displayed progeria, which Amitabh Bachchan had contacted. Then recently there was a movie of Kajol, Salam Venki. Her son was suffering from muscular dystrophy. Right? We've seen movies like Hitchki, Pink, a lot of it, and I think we thank the film industry also because, like we say, awareness is the first step to cure. राइट. अवेयर होंगे लोग तो आगे कुछ और स्टेप्स ले पाएंगे. डॉक्टर्स भी, सरकार भी. तो जब तक लोग नहीं जुड़ेंगे तब तक सरकार भी आगे कुछ करेगी नहीं. जब लोग एकजुट होंगे तो द गवर्नमेंट विल ऑल्सो पे अटेंशन, लिसन टू द वॉइसेस ऑफ दीज families, caretakers, and our rare warriors. So, on behalf of Ahmedabad, looking forward to the support of the state government, and we appeal to them to certainly set up a center of excellence in Ahmedabad. Thank you so much.
Thank you. Morning, sir. Can you please give your introduction?
Hello, I am Prasanna Shirod, co-founder and executive director of ORDI and also father of a rare disease patient.
And in the morning, sir, we saw around 1,500 people, dancing to the Zumba tune, and they all seem to be here for a cause. So, can you tell us what's happening?
Yeah, first I would like to say thank you to Ahmedabad, the citizens of Ahmedabad coming over on the Sunday morning to support the rare disease cause. Our Race for 7 is a mass awareness event to raise the awareness about 7,000 diseases, which has a challenge of average diagnosing period 7 years, and we have estimated 70 million patients. To create this awareness, take our message to the policymaker and other stakeholders so that we get support in terms of treatment, diagnostic, supportive care, etc.
And how has been your experience in Ahmedabad, sir, today?
This is the third year which we are doing it. In the COVID, we did virtually. Again, we started the physical event, and this year we are doing it in 13 cities. It is very encouraging that people have come forward and supporting a cause without any, they are not related to any rare disease or they don't have. It's just being standing next to us and to show that they care for rare.
And we saw some warriors today, sir, here who are all amongst us. What is the message you will like to give to the society?
See, basically, this all the warriors or a rare disease diagnosed with a rare disease, because of the stigma, they don't come out. That is the reason we wanted to communicate the messages that in absence of warrior, how do we communicate? This event has come, but it is very good to know that warriors also are coming forward. They know that they have to talk about this to the world and to the public so that they get support and required facilities from the government.
And finally, sir, your word for IAP who came forward and partnered us in this event
Yeah,
association.
in India, IAP is Indian Academy of Pediatrician with 40,000, 4 lakh pediatrician, and this is the first time they have collaborated with us nationally. And also happy to inform that today genetic as a subject is being launched in the IAP Pedicon Congress, which is happening in Ahmedabad and launching today. So we decided this 19th February only to coincide with their conference, and it's good that IAP has come forward, and I'm sure this awareness will spread to all the pediatrician in the country.
Thank you so much. Prasanna sir, in the post-event release, we actually read about a lot of important pointers where you wish to approach the government and talk to them about. Can you take us through
Yeah.
those key points?
Okay, today in country, central government has come up with a national policy for treatment of rare diseases, and there is an allocation of 50 lakh rupees budget for every patient one time for all the people. And there is a proposal to set up one center of excellence per state to start with, and then develop across the state based on that. But unfortunately, in Gujarat state, we do not have any representation of rare disease. So our request to the government is, number one, immediately ask for one center of excellence in the state, so that the Gujarat rare disease patients and families don't have to go to different places like Mumbai to get access treatment to get this 50 lakh rupees, which is very important for us to save the life. Second one is newborn screening is required in the state, because early diagnosis and we can treat most of the IEMs, inborn error of metabolism, so that there is no burden on the society in the future, and they can be a contributing citizen. Then third is we also request government so that we have a state policy, because health is a state subject, and state rare disease policy actually helps in a long term planning and supportive manage. Then coming to Gujarat is also industrially prosperous and pharmaceutically lot of industries are there. We request the government to take the first step in India to form a cell and gene therapy drug development, basically for research, training, and infrastructure development of raw materials, which is required for the R&D. So because today we have to import all these things, and this will help us in long term managing the 7,000 plus rare diseases. And finally, prevalence study has to be conducted to understand how many patients are, how many families are there affected with the genetic test, especially like tribal population. So now thanks to the government, they have come up with a sickle cell policy, because that is also one of the highest prevalence in the state. Similarly, most of the tribal condition groups are suffering from one or the other condition, and is very specific to tribal. So if we find out them, then we can solve the problem immediately. I think these are the six points which we ask for the
Thank you
government.
so much,
Thank you.
sir. I really